Hi everybody, I'm Dr. Britt Talley Daniel MD, a neurologist and headache doctor. And today I'm talking about a basic kind of problem with medicine anybody needs to know about, which is, what are the helpful rules for acute migraine therapy? Well, migraine is present in 12% of the world's population, and in 25% of women and 6% of men. And it's a severe, disabling medical condition that often leads to an evaluation in the emergency room. So what are the rules, helpful rules for acute migraine treatment? Here they are. Treat at the onset of the headache. Have your medicine with you. Treat early when it's headache mild and early. Take the right drug, and then take enough of the right drug. Treat at onset. That means all medications should be taken at the very beginning of a headache. Don't wait thinking it's going to be one of those, and it may be one of those, a bad headache coming on that'll send you down the emergency room. Headaches from migraine type may start at the back of the head and come forward into one eye or temple or behind the eye, or it could be just a normal headache that starts in the forehead or the eye or in the cheek area. Headaches in the cheek area are not sinus headaches. Sinus headache is not included in the International Classification of Headache, and usually that's a migraine. Sinus headache should have green or yellow mucus coming out of the nose, and it's really called acute sinusitis. But migraine can be in a similar area, and it's confusing. All the generic triptans except Triptan and Triptan work in 30 minutes, and they should be used. Those two drugs I just mentioned are long-acting, and they take 1 to 2 hours to work or come on. Probably the cutest drug that you can take is the Triptan. Obviously, that's injectable Imitrex, 10 milligrams, subcutaneous, just like Glaxo brought it out in 1991 when the Triptan started. American Academy of Neurology has said that's likely the best drug of all the Triptan group for treatment, and there's 7 Triptans. So it works in 10 minutes, gives a level 100 milligrams in your brain, and it's acute therapy. But all the generic drugs, except Triptan and Triptan, work in about 30 minutes, and they should work. I'm just going to list the Triptans' names here. So I've got Imitrex, which is Sumatriptan, Zomig, which is Zolmatriptan, Maxalt, which is Rizatriptan, Relpax, which is Elatriptan, and Axart, which is Almatriptan. And then the long-acting drugs are Frovatriptan, and Emerge, which is Naratriptan. 80% of migraine patients may be pain-free in 2 hours if they treat at onset. Triptans block the release of the neurochemical inflammatory drugs that come out during the migraine problem. And it takes about 20-40 minutes after a migraine starts for these chemicals to come out. If you treat early, the chemicals don't come out and the headache's not so bad. So Triptans are the universal best drugs for acute therapy of migraine. However, 20% of patients don't respond well to them or can't take them because they have a contraindication such as out of whack, out of shape hypertension is uncontrollable, previous history of myocardial infarction, stroke, cardiovascular disease of any sort. Then you got to take the right drug. And in general, for severe migraine patients, it's going to be a Triptan. It's true that many patients with mild migraine can get by using Excedrin or an NSAID like ibuprofen or Naproxen, but for severe headache patients, the types that can end up in the doctor's office or the ER, we usually need a Triptan. And usually Triptans will treat the whole migraine syndrome. They take care of headache, nausea, vomiting, sensitivity to light and sound, and they work best if taken at onset. And when I say then, the last rule here is take enough of the right drug. This is a dosing situation, which varies from patient to patient. Elephant rifle load, that means the biggest gun, again, is injectable Sumatriptan, Imitrex, 6 milligrams subcutaneously, which works the fastest. So I hope these thoughts are helpful to all you patients with migraine. There are newer drugs that have come out on treatment of migraine in 2020. Those are discussed on other talks. They can work for the 20% of patients who don't work well with Triptans or who have a possible side effect you can't use them. So God bless all you patients with migraine. Please click subscribe down there so we can keep in touch with each other. And I will see you all on the next talk.